We've got a weird healthcare system. I'm a computer scientist by training, and I didn't understand how to use data to find the right physician to go to, how to understand what things would cost us. I was going through pregnancy with my wife for our first kids, and we couldn't figure out how to use the healthcare system properly. When we had our second kid, I went with my wife into the maternity wards to deliver the baby, and I had a little cheat sheet printed out with a C-section rate of each OBGYN we potentially would encounter that night. That's information, data that the insurance company has about the healthcare system that they never or rarely ever share with members. Basically, everybody in the system is part of a cost-plus system that's inherently inflationary. The more transparent and the more easily usable you make the system, the less you can perpetuate the inflationary nature of it. We have, on average, 3 years shorter life expectancy for Americans than for Germans, Japanese, French, Italians. We've got some of the best hospitals in the world as well in the country, but overall the system isn't delivering, particularly given the fact that it's so expensive. And if you look at where that's coming from, it's not coming from overutilization. We go to the doctor less, we go to the hospital less than any other rich nation in the world on average. It's purely coming from the cost of service. Once you are in the hospital, once you're at the doctor, those costs are about twice as high here in the US than any other rich country in the world. You don't buy your own insurance most of the time, you get a three-employer. You don't really know what something will cost you when you have a copay and you go to any doctor out there. You don't really know which hospital is delivering high quality for a high price or low quality for a high price. As a result, nobody in healthcare really feels the pressure that you as end users of healthcare could exert on the system, and that's why ultimately the system ends up being so crazily overpriced, so hard to navigate, and why I believe many actors in the system have sort of an incentive to keep it the way it is. The big discussion over the next 10 years will be how can we make healthcare more affordable as a whole. We think that through engagement and technology, costs will come down and we can navigate your healthcare more cost efficiently for you. You will save money if you come to Oscar compared to if you go to any other insurance company out there. But a lot more needs to happen that really everybody in the US thinks, I can afford health insurance, I want to buy it, I want to get the best possible plan for me.